Well, good morning. Thank you everyone for attending today. My name is Misty Baker. Don't be afraid to ask any questions whatsoever, and I guarantee you are going to have a few. You also might get angry with me some point in this presentation because I'm going to require you to do a lot of work over the next 10 months as a business owner. There's a lot of good stuff coming down the pipeline for some of you. So today's all about health insurance, small group, large group, individual. Basically, every U.S. citizen and legal resident in our country will now be required to have health insurance. Not any kind of health insurance, but a qualified health plan. We're going to talk about that in detail. So first things first, you probably heard a lot of information about health reform in the past 2 years. My full-time job, and it's not just 40 hours a week, as I was telling Maya and Jean earlier, my full-time job is to do nothing but study health reform. So when I say health reform, some people call it PACA, PPACA, ACA, Obamacare, whatever you call it, it's all the same thing. The requirement to have health insurance in our country. So the first things first is just take a deep breath. The law that was passed in 2010 doesn't exactly look the same as it does today. And here's how it works. They passed a big giant bill that nobody ever read. Well, I did a couple of times. And now what they're doing is they're making sure that all the law can actually work for you, the employer. It's a very tough job. So tough, in fact, that IRS came out with 18 pages of guidelines just talking about what a full-time employee is. 18 pages to define a full-time employee. Now that document only took me about 40 hours to go through because you have to go through line by line. You have to really focus and think about who are your employees. We're going to talk about those today. Hopefully I won't confuse you too bad. On your table is a memory stick, and it has this presentation on it. It's updated very frequently, weekly, as a matter of fact. So what I say today, actually what I said on Tuesday is different than I'm saying today on Friday, because we got 150 pages of regs that came out on Tuesday afternoon.
Are they on here?
They're not on there. Nope. I'm going to talk to you, though, about some of the changes that were made since Tuesday. 4 entities really are going to rule your life in the next probably 18 to 36 months when it comes to health insurance. The most important one is probably the Department of Labor and the IRS. Your very friendly friends, the IRS. They put out a lot of guidelines. They talk about taxes. They talk about penalties. They define different entities such as full-time, part-time, seasonal employees. The CCIIO is another entity that was created by health reform, or PACA. They are supposed to help us through this insurance maze in the next 18 months or so. So there's some key timeline issues that you need to kind of keep in mind. And 2013 is already here. These key timeline issues are already in place. So state notifications of exchanges, that requirement was due on Friday. And Governor Perry has decided that in the state of Texas, we will not run a state exchange. It's not such a bad thing. State exchanges are very unknown. We have no idea how much they're actually going to cost. We could get grant money. As a matter of fact, we did get grant money to the tune of $1 million in 2011, and Perry sent it all back. Well, they spent $100,000 of it, but the first, they gave the rest back. Doesn't mean we're not going to have an exchange in our state. It means that the federal government's going to come into our state and run it for us. We don't have to quite pay for it yet. Eventually we probably will. And this is something that the governor at any point can decide to change his mind on. He could possibly say to the feds, hey, look, we think you're doing a good job and we want to take over, and we'll open up our checkbook to do that. Now that's going to be pretty expensive and pretty costly, because setting up an exchange for our size state with our extremely different demographics, when you're looking at somewhere like Houston versus the Valley, the doctors don't like to participate in networks that are statewide. Some of them are very regionalized, so it opens up a whole new can of worms. It's not like living in Massachusetts where everyone's super close. Flexible spending count limits, those were limited to $2,500 per year in 2013. You've probably already seen that. The Medicare tax increase, those are for high income earners over $200,000, and now they're faced with an additional 0.9%. your payroll company or your payroll person has probably already helped you with that. Tax on medical devices, it's an excise tax of 2.3% on medical devices. And generally what's going to happen there is you're not going to receive a bill for an additional 2.3% for your hip replacement. The part inside of you that gets replaced or the plate in your head, it's all kind of rolled into premiums and taxes that way by the manufacturers. 2014 is when all the fireworks start to happen. 2014 is when exchanges must be online. There will be a mandate for every U.S. citizen or legal resident in our country to purchase health insurance or pay a penalty, tax, or fine. You're going to hear me say penalty, tax, or fine because I don't know what you want to call it. I call it a tax, personally. But some people call it a penalty. That sounds like it eases the pain a little bit. I'm not sure. It's still a check that you're writing. So in 2014, we have the potential to expand Medicaid. Now, we are not going to expand Medicaid in our state. Well, that was the governor's line earlier this week, at least. And Florida's governor folded, and they're going to take the Medicaid expansion. What you'll hear in the news is that we're leaving money on the table when it comes to Medicaid. Medicaid participants are the poorest of the poor. And so those are the people that need the most help when it comes to getting health insurance. PACA was passed to help the uninsured. That was the #1 issue. They wanted to get the 26 million people off the street and get them insured. The law isn't really going to do that. It's going to create more expensive premiums for most of us, but it doesn't really incentivize people to get health insurance on their own because it raises the price a little bit. So this week, Governor Perry is still on the no fence. We're not expanding Medicaid up to 133%. Some states will, and they'll draw down federal money, but we are not going to do that. There's some presumptive eligibility for Medicaid and also, of course, the individual mandate or the requirement to have health insurance in our country. The state exchange will be created, open for enrollment come October 1st of 2013. That's just a mere 8 months away, 10 months away. We're still in February, right? Health insurance premium and cost sharing subsidies will also be available only within the state exchange. Now, Oklahoma has a court case pending in the Supreme Court of Oklahoma that says the law actually says you only receive a subsidy if you purchase health insurance through a state-based exchange. One of the things the federal government's doing is they're clarifying the law through rulemaking. So the rulemaking now says that you can actually receive a subsidy if you purchase insurance from a state exchange as well. So a federal can run it, it can be a state partnership with the feds, or it can be all state. So Oklahoma is challenging that case. I highly suspect they'll lose that case, and we will see subsidies within our state-based exchange. So subsidies are basically the government's going to give people who participate in the exchange, they're going to give them money right there on the spot. And we're going to talk about what an exchange looks like and how your employees might actually access one. Guaranteed availability of insurance. This is probably the most talked about provision of health reform, and it just says that no matter how sick you are, no matter how many pre-existing conditions you have, you are now guaranteed health insurance in our country. No one may be turned away. What it doesn't say is how much it's going to cost you. There are no cost provisions on how much it will cost. Let me give you an example. When this law passed, it said children under the age of 26, by the way, children are all the way up to age 26. Now, if my boys stay on my payroll till 26, I am not going to be happy. So children under the age of 26, and really it's 19 for pre-existing condition purposes, they're guaranteed issue currently, right now. So if you have a child who has a pre-existing condition, a hemophiliac, a cancer child, someone who has a mental issue or mental disorder, before health reform passed, those kids would be declined health insurance on the individual market. But today, there is no declination. Now, what the insurance companies did is they tightened up two things. Number one, they said you can only enroll in an individual child-only health plan one time a year. It's 30 days. The second thing they did is they said, we'll take you, but we're going to charge you up to 700% of the regular rate. So they've already kind of showed us what's going to happen with rates when you look at these child-only policies, and really when you look at guaranteed issue in general. We can look at other states who have the same kind of provisions, and their rates are very, very high. If you look at Massachusetts individual plans, their average premium's over $1,500 a month for a single male in his 40s. That's very different than what Texas looks like. And then, of course, no annual limits on coverage, and I'm going to explain why that gives me a heart attack here in just a minute. 2014, some more highlights, essential health benefits. You guys are all going to want to pay attention to this because there are a lot of things in here that you may not be offering currently. Multi-state plans is the government's way of creating competition within exchanges. Multi-state plans will come into every single state, multi-state, that's why they're called that, and they'll offer two options inside of your exchange. One must be a nonprofit and one must not offer abortion coverage. I know no one likes to talk about abortion, but it's in this law inside and out. It's very controversial. Employer requirements, if you're an employer over 50 full-time employees or full-time equivalents, you must now pay or play, and I'm going to teach you how to do that. Wellness programs are also going to be introduced all the way down to small groups, and there's some incentives there, it's kind of like a carrot and stick incentive. So let's jump right in and start talking about the state of Texas. So currently in the state of Texas, our small group definition is from 2 to 50. Full-time employees. Full-time means 30 hours a week or more. Your definition of a full-time employee might be 35 hours a week. It may be 20 hours a week. But the feds are going to tell you that your definition is now 30 hours a week or more for insurance purposes. So right now in our state, we have this bottom chart that we need to follow. So if you have an individual plan, that means your employer does not offer health insurance. You don't offer insurance as an employer. You purchase it from the outside market. You will have community rating, and you will also have essential health benefits tacked onto your plan. And I'm going to explain to you what those two things mean. If you're a small group with 2 to 50 full-time employees, you also will have a community rate and essential health benefits tacked onto your plan. But if you have 51 or more employees, you don't have those two very expensive provisions, but you must pay or play. That means you must pay the penalty, tax or fine, whatever you want to call it, or play in the health insurance world. So currently there are two bills running through the Texas legislature, and they both define small group as 1 to 100. So if you're an employer with 55 employees, you do not want to be here. You do not want to be community rated. You do not want to have essential health benefits, and I'm going to tell you why. It's because it's going to add another layer of cost onto your plan. So we want the definition in Texas to say 2 to 50. Actually, what I think it's going to do is it's going to go to 1 to 50. And so you may ask yourself, well, why in the world would a group be one person? It gives you more options. If you're a small employer, you're a sole proprietor, it now gives you the option of having group insurance where you get some tax benefits as an employer versus an individual plan. So that's why they'd go down to 100. The health reform law gave us this choice. It gives every single state the choice to define their small group, their small group number. Some states are 1 to 100. And so if you're a mid-market person with 51 or more employees, that number is going to look very different, say if you were in Massachusetts than you were in Texas. So we really want to preserve this. We get to preserve this for only 2 years because in 2016 we have no more choice. Everybody's going to get bumped up to the community rating and essential health benefits if it really tracks the rulemaking that we have currently. So I'm talking to my small group owners right now. So if you have a small group where you employ less than 50 full-time employees, or 50 or fewer full-time equivalents, then your whole world is fixing to change. So currently, if you're a small employer, what do you do every year? You get a renewal, your broker brings you a spreadsheet and has 15 options on it, and you look at all the comparisons beside each other, and you say, okay, well, I'm going to take a Humana plan this year, and then you're going to get this paperwork to fill out, and it's going to ask all your employees' medical questions, right? That's called underwriting. If you have Blue Cross, you have a gatekeeper question where it only asks you one question as the employer, but most Most small group plans ask each employee questions. That's what determines your final rate, right? So once you turn in all those paperwork and you find out you have 5 pregnancies and a lupus and a cancer, then the insurance company gives you back the final rate. Okay, so now what's going to happen under community rating for, remember, groups of 2 to 50 is that you don't get to get underwritten anymore. So now your rate is based off only a few things: age, zip code, coverage tier. Coverage tier just means employee, employee plus spouse, employee plus child, that kind of thing. And if you're a tobacco user or not. So tobacco users can get charged 50% more than your non-tobacco users. So when Billy Bob's got his little skull thing in the back pocket, you know, dented in his jeans, you can say, hey, Billy Bob, I think I need to charge you a little bit more for your health insurance because you are a tobacco user. And he's like, well, no, I'm not. Psst, spitting out, you know. It's all self-policed at this point. There are no regulations currently that will allow an employer to penalize a smoker with 50% higher rates. So what we're seeing many carriers do is not even ask if you're a smoker or not. Carriers are saying, you know, we're not going to ask anybody. We're just going to charge everyone a little bit more to spread the risk out. So another cost driver. Not all carriers will do that, though. What does that mean to you as the employer, though, if you have to charge Billy Bob 50% more than Sally Sue? Right? We're going to see some different rates. Who's going to keep up with that? Payroll deductions coming out. Keep that in mind. So let me explain to you why community rating is going to change your life. So currently in the state of Texas, we have one big giant pie. And we split that big giant pie into 5 pieces. And we each, every month that we're paying premiums, we each eat 1/5 of the pie when it comes to our premiums. I can eat 1/5 of a pie, especially if it's pecan, I got it. But in 2014, with community rating, what that means is we take that big pie and we split it into 3 slices instead. Can you eat 1/3 of a piece of a pie? Now, some of you who are between 50 and 64, you're going to love your pie. Let me tell you why. It's because your pie is being subsidized by the younger people. So younger employees are going to see a huge rate increase, right? Because we take, instead of 1/5, everyone's paying 1/5, now everyone pays 1/3. The 50-year-old and plus, we're paying a much higher premium. So we expect to see the demographics probably around 55 is the sweet spot. We expect to see in small group 55-year-olds see a 22-ish percent rate decrease overall in our country. And if you're 56, you're like, yes, finally, right? I got AARP and I got a rate decrease. But here's what's going to happen, is that your younger generation, the people who are 19 to say 36, the people who never buy health insurance, the people who never go to the doctor, who never get sick, their rates are going to increase 162%. Okay, and they're not going to want to have health insurance anymore because guess what? They want a bass boat and a 6-pack. They don't want health insurance. They never get sick. Think about when you were 22 years old. Did you have health insurance? Did you purchase it by yourself? Did your parents make you do it, or did you, in good faith, say, you know, I might stub my toe. I got to have health insurance. So this law didn't change the way people actually view health insurance. It did put a penalty in, though, for those people who do not choose to purchase health insurance. I want you to hold on to your seat because I'm going to tell you what the penalty is. It's $95 or 1% of your income for the first year. So you tell me, if you're a 25-year-old employee who is going to be charged $400 a month in premium, wants to pay the premium or pay the $95 fine?
Is that a monthly fine?
No, sir, that's an annual fine. And when you file your income taxes, that's when you're fined. Now, the penalties do go up after the next year, and in the third year, the penalties is $695. So they do go up a little bit. But if you ask me, my premium as a 40-year-old female is going to be higher than $695. Yes, sir.
The percentage go up also?
The percentage does go up also. So the first year it's 95 or 1%, and then it goes up to 2%, 3%.
Does it ever get to the point that it crosses where it makes more, costs the same?
We only have 3 years worth of data so far. Yeah, so we don't know anything outside of that. I would also say that it will take at least 3 years for our health insurance kind of industry to shake out. So it may be rough going for the first 24 months. We all may be a little confused, and then eventually things are going to get stable. Rates may get stable. We might see different subsidies. Things are going to definitely shake out, but it's going to be a rough 3 years. Any questions on this underwriting? This is a very big deal. I don't know why the news doesn't pick up on this.
On the
Yes.
penalties, does employers pay that or employees? How's that get determined?
The question is about the penalties and who pays them. If you're a small employer with less than 50 full-time equivalent workers and you do not offer a qualified health plan, I'm going to tell you what that looks like. Small employers never pay a fine, tax, or penalty. If you're under 50 full-time employees or full-time equivalents, you never pay a tax. You also do not have to offer health insurance. So if you are a small employer, then your employees are then responsible for their own penalty. It's called an individual mandate for a reason. So you individually get to pay the fine, tax, or penalty if you do not have a qualified health plan. If you're a large employer, over 51 lives, then you must pay or play. So you pay the tax if you don't have the correct health plan and you don't make it affordable. So it depends on your situation. It depends on who you work for. If you're an individual and you don't have any kind of health insurance, or you work for a small employer that doesn't offer any health insurance, you have the $95 fine. Additionally, if you worked for a large employer and they also don't offer a qualified health plan or make it affordable, and you choose not to purchase their plan, you also are penalized the $95 or 1%. If you're a large employer, you are only responsible for the employee only. And I'm going to talk about all that here in just a minute. All right, so let's talk about essential health benefits. So small employers with less than 50 full-time equivalent workers, I'm still talking to you. You must offer these Big 10 essential health benefits. And they look pretty easy to offer, right? So ambulance, in-hospitalization, labs, x-rays, preventive care, prescription drugs. Let me give you a little gotcha. And I only know this because I looked at every plan offering for small groups in Texas. So I have a chart with everybody on it. This Big 10 looks pretty easy until you get to number 10. And that's called pediatric services, including oral and vision care. So if you're a small employer in the state of Texas right now, when you renew your health plan in the year 2014, you will absolutely be forced to change it. Unless you're a grandfathered plan. And if you're a grandfathered plan, we can talk after. You're going to be forced to change your plan because you have to offer pediatric services, oral and vision care. And I don't know how much you have to offer yet. We don't know yet. We got a few more clarifications earlier this week. So is it 2 cleanings a year? Is it eye exam, eyeglasses for children? We don't know yet. So this doesn't look terrible, right? Unless you're a 55-year-old man who's not married, and you are now going to be responsible for having maternity coverage on your plan. You can't take it off. Or if you're a 60-year-old woman with a hysterectomy, you're now paying for maternity. And you're also paying for pediatric vision and dental, by the way. Everybody's going to spread that risk for all individual and small group plans. The other thing that really gives me a lot of heartburn about essential health benefits is mental health. And it's not just mental health, it's called full mental health parity, which means now that on your current plan, you have limitations when it comes to inpatient and outpatient mental health, including chemical dependency, right? So someone goes to rehab for 30 days, they come out. They can go to rehab maybe one more time in a calendar year, and then they're done. The insurance company is not going to pay for it anymore. Well, what essential health benefit says is that you can be in and out of rehab as much as you need to be. You can be in and out of mental health facilities, both inpatient and outpatient, as much as you need to be. There is no cap on those things. So if you look at what full mental health parity actually says in it, the book is, I don't know, 7 inches thick. I didn't know there was that many mental disorders in this world. But when you flip through it, one of the things you'll see is jet lag is considered a mental health. I got some mental health. I'm jet lagged. My flight got canceled from Harlingen. I'm tired. Yes, sir, you had a question?
That was my question, was the limits on those particular items.
Yep, the limits don't exist. Now, one of the things that you will see that there are some limits on, well, if you want to call them limits, is when it comes to contraception. Contraception is a covered benefit for women, but not for men. And if there's a generic available when it comes to birth control or an implant, those need to be paid for first, and they're paid for by the insurance company at 100%. There's no cost sharing. When I say cost sharing, it means deductible co-insurance or co-payments for contraception. Yes, sir?
Is there a reason why we couldn't find a grandfather plan and switch to it now before 2014?
No, sir. You have to have the same health plan that you had in March of 2010, and you could not have changed it by more than 5% in contributions. So if you liked what you had in March of 2010 and you kept it, you're okay. Any questions on essential health benefits? This is where people start throwing things at me. Maya's seen it happen. All right, more essential health benefit stuff. Here's where I'm backing up. How many of you have a more than a $2,000 deductible on your health plan currently? Guess what? No more. In 2014, when you are forced to change your health plan, if you're a small employer, you may no longer have anything higher than a $2,000 deductible for a single and a $4,000 deductible for a family. Now, there are some caveats to that. The rules that came out on Tuesday afternoon said if you cannot reasonably get to a $2,000 deductible with a 60% actuarial value, then you can have a higher deductible. But I can't find the definition of reasonable in the law or the regs. So we're still working on that. Yes, ma'am, in the back?
This is still for employers with
50 or fewer. This is still small group. So large groups over 50 do not have to offer essential health benefits. You do not have to have a $2,000 deductible, but you must pay or play. So you're feeling like a fat cat right now because you don't have to do this, but I'm going to totally rain on your parade in a minute. Yes, sir.
Can you clarify? I thought you said that under 50 they didn't have to offer anything.
You're correct. If you're a small employer with under 50 employees, you do not have to offer health insurance at all.
But if you offer it, has to have this.
But if you do, it must be essential and it must be community rated.
If you're under 50, is there a tax or fine?
If you are under 50, you do not get taxed, fined, or penalized if you do not offer health insurance to your employees.
So life can go on.
Do you offer health insurance to your employees now? Okay. So if you're a small employer and you don't do it now, it's business as usual, with a few caveats. There are some things you must report to the government. The other thing that I have on this slide, and it's going to be on your memory stick, is the maximum out-of-pocket for 2014. Currently, we have it set at $59.50. That number will change. I think the number has already changed based on some actuarial value stuff that we've seen in the past week. So I wouldn't take the annual maximum out-of-pocket as true gospel just yet. But these other things like preventive services covered at 100%, oh, let me give you this. So how many of you currently, large and small group, have preventive care covered at 100%? Right? Any of you go in for a colonoscopy recently? You don't have to raise your hand. Don't do that. So what happens is you go in for your colonoscopy and you're like, woo, free care, right? I drank the thing, I saw my doctor, I got some sleepy pills, I'm feeling good. Oh my gosh, I took out a polyp, right? So your preventive service just went from 100% coverage because it was preventive to, oh my gosh, they removed a polyp, I'm sick. What happens when they remove a polyp currently? Deductible and co-insurance, right? And you wake up and you're like, what? I gotta write you a check? Guess what? The federal government came out Tuesday and said no more. If you have a colonoscopy and they remove a polyp under a good faith preventive care service, they may no longer charge you any cost-sharing provisions whatsoever. Are you clapping? You're like, yeah, colonoscopy for everyone. Okay, so your employees are absolutely going to love this. They're going to love it because they're not going to be waking up and they're not going to be surprised with a big bill, right? What is that going to do to your rate? What is that going to do to your renewal? Colonoscopies are not free. Okay? Yes, sir.
I know in a lot of the clients that I have, we've increased the deductibles, of course, to bring down the premiums, to make it more affordable. And looking at this, it almost seems like by going with said $2,000 deductible, smaller companies aren't going to be able to afford it, which means that the employees aren't going to be able to afford it. So is that a way to channel everybody to just give up and go to the exchanges? That's almost what it seems like. They're trying to force that situation.
The question is, does small group insurance become unaffordable because of essential health benefits, community rating, and these deductible requirements? The jury's still out. Okay, so there are some things when it comes to essential health benefits that give me a tiny glimmer of hope to be affordable. The thought process behind this is what we do is, instead of just you guys having health insurance and you're putting all your money in the health insurance pot, we want everyone to put their money in the health insurance pot, right? So we spread the risk, we spread everything out amongst everyone. Well, sometimes that works and sometimes it doesn't, because this table might say, I'm not doing that. I am not spending my money on health insurance. There's no way. How many people in our state don't have car insurance right now? So we know, because we've seen evidence when it comes to other insurances, that just simply mandating someone to have health insurance and they're going to get a ticket, it doesn't always work. So the answer to your question is are small employer plans going to be unaffordable? I would say that everything I have seen, every study I've read, points to an increase of premiums for small employers between 30 and 50% in the year 2014. And I can back that up with a Milliman study. I would also tell you that if you're going to jump ship and just tell your employees, look, go get an individual plan, I think individual plans in our state will increase 100% in 2014. We have some very specific laws in the state of Texas that omit very expensive coverage. Maternity is one. Mental health is the second one. Huge cost drivers when it comes to premiums. And individual plans in our state don't cover those things. They don't have to cover those things. So what happens when you have a preemie baby that costs $1 million on an individual plan, or a hemophiliac, or someone who comes in and out of rehab? You know, rehab can cost $60,000 a month, some of them, in Texas. So I just worry that it's going to continuously drive up the cost, because nothing in health reform addressed the cost of your health care. It didn't say your MRI can only cost $800 now. Nowhere did it say that. So how do you determine if you're a small employer or a large employer? And you have to do some math in order to get there. I'm going to give you an example. Say if you have 25 full-time employees, and full-time definition is how many hours a week? 30. Excellent. So the government says 30 hours a week or more is a full-time employee. We have 25 of those on our payroll. But we have 40 part-timers also on our payroll. And you're thinking, part-timers, I got to count them? I don't want to give them health insurance. I don't give them health insurance today. You got to count their hours. So you have 40 part-time employees, and they work 80 hours a month. So we're doing 40 times 80, we get 3,200 hours. We divide those hours by 120, and we get this number right here. It's called full-time equivalents. We also have 35 seasonal employees, and they work less than 120 days a year. So here's how the math shakes out. We forget the seasonal employees because they work less than 120 days a year. So you take those off your calculation right away. You have 25 full-times plus the 26.6 full-time equivalents, because you got to count up all your part-timers plus their hours and divide it by 120 to equal 51.6. That's 51.6 bodies that you have. Are you large or small at that point? You are a large employer at that point. Now you have to pay or play. Yes, sir.
The small group, how are these regulations going to affect the participation requirements from the insurance carriers?
The question's about participation for small group and large group, and the answer is we don't know yet. We think that participation will remain at 75%, but the carrier, it's going to be very carrier specific, and they haven't come out and told us what that number is yet. So if you have 51.6, and we used our part-timers to get there, as a business owner, you're thinking in your head, well, what am I going to do? I don't want to pay or play. What are you going to do? Retire? You're going to fire 2 people. You're going to reduce hours, right? You're going to form 2 companies. Bad idea. I'm going to tell you why later. Somebody's going to do something in this case. And we don't round in health reform. Okay, so we have basically 51.6. We're a large employer. We may do something about that. This is the first and only time you ever care about part-timers is right now doing this calculation. As soon as you do this calculation, I want you to forget about part-timers. You don't offer them insurance. You don't get penalized if you don't offer them insurance. They are dead to you. Okay? Yes, ma'am.
What about we're a staffing agency, so over a year's time, I mean, we don't have people full-time for a year. We're usually off the payroll in 3 months. We have under 50 that probably stay on for the year. Are there different calculations for that?
Yes. And I'm going to explain to you how to do it, and I hope you have a pen because you're going to need to take some notes. If you're a staffing company, I'm going to hear you cry in a minute. No, it's not that bad. So here's how we get to 50 full-time or more equivalents. If you are an employer with 30 full-time people and you also employ part-time or variable hour employees, someone who maybe works for you a little bit and doesn't, you want to make sure that you're staying underneath the 50. Unless you want to offer health insurance. And God bless you, I want you to offer health insurance. We have 4 classes of employees. Everybody has them. You have the people who always work for you 40 hours a week. They're your salaried employees. You probably don't collect time cards from them. They get vacation, sick, bereavement, disability pay, salary guys. We don't have to worry about them too much. They're always working 40 hours a week. The second kind of employee you have is you hire them on as a full-time employee, and they may work 32 hours a week. They turn in time cards more than likely, but they're working 30 hours a week on a very consistent basis. The third kind of employee you have is these variable hour employees. You don't want these people. So these are the people who you hire to be full-time, that you put them on a special project, and now they worked 42 hours for you this week, and they work 26 hours for you the next week, and they work 31 hours. Their hours are all over the place. You get timesheets from them. If you're a staffing company, these are probably all of your employees. These are the guys we're going to talk about in depth. And then the fourth kind is a part-timer. They always work under 30 hours a week. You hired them to do 10 hours a week doing special projects, or they're just simply part-timers. If you're a restaurant, this is a good place to keep your employees. They must always work less than 30 hours a week.
Time is set, right?
Right, so you use part-timers to determine if you're large or small. And then if they are part-timers, if actually they're a variable hour part-time employee, so you hire them in to work 20 hours a week, but they don't always work 20 hours a week. Sometimes they go way over that. They're a variable hour employee. But if they only work 20 hours a week for you consistently, or really anything under 30, you don't have to worry about them anymore.
Okay, but my question is, at what point does it trigger when you do the FTE calculations? At what point do you become, let's say half your workforce is part-time, and you do the calculations for the FTE, and they say, okay, you now have over 50 employees.
I understand.
Okay?
I'm going to give you that here in just a second. I'm going to show you how that works. We have a graphic for it. So the couple of things you need to remember about your full-time and bringing people on your health insurance is you may not let them wait any more than 90 days to get on your insurance. Not first of the month following 90. Okay, that's illegal. This is very much set in stone. So if you are doing first of the month following 90, come 1/1/14 when you renew your health plan, no matter what size group you are, you cannot make your employees wait more than 90 days. You can do first of the month following 60, that would be okay. Let me also just kind of interject here is that if you're a small employer group or a large employer group and you have insurance currently, health reform kicks in for you on your renewal date. So if you have a March 1st renewal date, so you're going through a renewal now, you're going to be the fresh, beautiful guinea pigs in 2014 to get on health reform. You're going to be a first quarter person getting into health reform in 2014. So you don't have to comply with everything right away. What if you're a January 1st renewal? You just did it. Yeah, you're loving that, right? You're the first person to go through it. There are some strategies to help you do that. And you should talk to one of the Dean and Draper guys around here because there are a lot of really good things to do, some possibilities that can help you avoid that. One of them is moving your renewal date. So if you are a October, November, December renewal, which there aren't a lot of those, but if you are, you're really lucky because you're going to wait for everybody else to come through. Health reform, you're going to see things shake out. You're going to see how it works before you have to jump in. You're also going to hear rumors about what health increases look like for the first 9 months of the year. Yes, sir.
Presently, don't the carriers sometimes insist on first of the month as opposed to mid-month enrollments? And if so, is that going to change as well? Will they have to change, or would you have to choose 60 to stay under 90?
The question is, do carriers generally say first of the month following something or first of the month, but they also offer 30-day, 60-day, 90 days flat. So it just depends. And it's going to be very carrier specific. You're going to have several options, but today even there are options to do just a hard 30-day. Now keep this in mind when your accounting person is helping you with payroll deductions and all those kind of good things that they have to do. So if you hire someone on March 17th, they're going to have to prorate everything for the rest of the month. Unless we get some kind of forgiveness, and I've seen insurance companies do that. If you're actually prorating, if you're hired after the 15th day of the month, you don't get charged premium. So it depends on what every carrier is going to do, and you just have to stay tuned to see what they do. All right, so we have all these employees, and we put them in different buckets. The first bucket is everybody's in one pot. Then we're going to say, okay, this pot of workers consistently works 30 hours a week or more. They're probably salaried. Then we have people who are seasonal, 120 days or less a year. Then we have people who work less than 30 hours a week, but sometimes they work more, sometimes they work less, or they always work less. What do we do with them all? The federal government says we're going to measure them. Here's how you do it. I'm going to show you a nice graphic. So any large employer, someone with more than 50 full-time equivalents, really needs to be paying attention to this. If you were an employer with 30 or more, I would say you definitely need to pay attention to this as well, just in case. The first thing you're going to do as a large employer is you're going to establish a measurement period. And the measurement period is anywhere between 3 and 12 months, and you get to pick what's best for your own company. So if you're a staffing agency and you have the highest staff turnover in the summer, you're going to want to really look at that for your measurement period. And it'll all make sense in just a second. I want you to start measuring your measurement period if you're a large employer as of January 1st of 2013. Now this might be a little bit of an overkill, but you need to have 12 months worth of data so that you can go back and say, okay, my highest turnover is in the spring. I have the most employees come on in the fall. So you got to know exactly how many employees you have for every single month and how many hours that they work for you. If you have any kind of variable hour employee, this calculation is really important because this is going to trigger a fine if you don't do it correctly. So the first thing you do, you pick your measurement period. The second thing you are going to go through is an administrative period. The administrative period lasts anywhere between 30 and 90 days. I would say 60 is the best administrative period. That's because I think 30 days is too short to notify someone they're due for coverage, enroll them, provide an SBC, which is the summary plan descriptions, talk about payroll deductions, get everything, if you're a large employer, to get everything in the hopper to make sure it's done. But 30 days might be long enough for your company. Remember, you can't make them wait more than 90, so 90 is the longest you can go. So we measured them. They're a variable hour employee, and guess what? Say they work 34 hours a week consistently for me. They weren't on my health insurance before, but now they're going to have to be. In my administrative period, I say, guess what, Sally Sue? You're now eligible for health insurance, and you have 60 days to enroll in my health plan. Here's all the documents you need. So now we're in the stability period. So Sally Sue needs to stay on my health plan for a minimum of 6 months or the longer of my measurement period. Clear as mud, right? So say Sally Sue worked for me for a whole 12 months, but her average hours were 31 hours for me every week. I now have to offer her health insurance during the administrative period. So I give her 60 days, I give her all the proper documentation, we get payroll deduction set up, we get her in the hopper, and she's ready for health insurance. Here we come. But then Sally Sue decides, you know what, I don't like working 30 hours a week for you. I want to work 10 hours a week. Now, I know I'm on your health insurance. She's now in what's called the stability period. So no matter how many hours she works for you during the stability period, she's still on your insurance. So even though she may qualify as a full-time employee during the measurement period, during the administrative period, if at any point during the stability period she decides she doesn't want to be a full-time employee anymore, she's still on health insurance. This is really great for keeping people insured, right? It's excellent. What's the problem? If Sally Sue's only working 10 hours a week for you and her premium is more than 10 hours a week, how are you going to get that money? Who's going to pay for that? We don't know yet. That's one of those things that we're like, do you terminate her and make her go on COBRA and she has to pay 100% of the COBRA? We're not sure. So that's one of the things we're still kind of working on through I'm not working on it, I'm just reporting it on the rulemaking. So these measurement periods apply to you I'm going to say if you have about 30 employees, full-time employees, and if you have really any part-timers at all, you want to make sure that you're doing this. And so people ask me all the time, well, I have 80 full-timers, they always work full-time, and I say, great, I would not worry about doing this. But if you happen to have a payroll company doing your payroll, or you happen to have software that you write your own payroll, you do your own payroll in-house, use the software reports to measure the hours they're working. So if the IRS ever comes back to you as an employer and says, okay, what is your measurement period? Tell me about your stability period. You're going to say, okay, I know because I have all these reports from my payroll company. They're going to tell me how much hours each of my employees work, and I'm fine. Because if you do this wrong and someone comes to you and says, you know what, boss, I've worked for you for 32 hours a week, and I've done it all the time, and you still haven't put me on your health insurance. And I got cancer, and I really need health insurance now. What's going to happen is that employee is going to go to the exchange, possibly receive a subsidy, and then you're sunk. That's when your tax kicks in. That's an excise tax to a large employer. So you want to make sure that you're doing this. If you have any variable hour employees, staffing companies especially need to stay on top of this. Yes, ma'am.
So is the measurement period, it says every 3 months up to every 12 months. So how often do you just do it one time? Do you do it every year?
No, ma'am. You're in a constant state of measuring throughout the whole year. So think about a tire moving along on the road. You just keep moving and moving. So at all times, you're in a measurement, an administrative, or a stability. Then you start all over, measurement, administrative, stability. And as your employees come and go, if you have high turnover, for instance, you got to make sure that you're measuring them correctly. So this is an ongoing annual process. So you, in theory, could have several open enrollment periods or administrative periods in a year. So if you had someone with no health insurance who comes to work for you, and they consistently work over 30 hours a week, they're going to get enrolled. New hires, of course, can't wait more than 90 days. This is really for your variable hour employees.
So if you choose to measure an individual in 12 months, and then they stop working less than 30 hours after you enroll them and get them in their benefits, then you'd have to supply benefits for 12 months if you choose that as your measurement.
That's right. So your measurement period and your stability period need to be the same if they're over 6 months. So yes, you could potentially have someone on your health plan for an entire 12 months after they get on the plan, even though they don't technically work full-time for you anymore. Yes, sir?
So if you hire somebody supposedly full-time and they end up having lots of sicknesses and things and they only end up working 25 hours a week for the first 3 months, does that mean that you don't necessarily have to put them on at the normal 90-day period that you would? You get to wait a little bit longer?
No. Once you hire someone with the intention of being a full-time employee, then they have 90 days, no more than 90 days wait. In addition, if you pay people for time off, vacation, jury, bereavement, sick, disability, holiday, those are counted as paid hours. So all that counts as paid time. Any other questions? I can help you guys move, and any of the staff here can help you move through these. They've got this stuff down. All right, so what about common controlled companies? The gentleman in the back said, I'm going to have a new company. Bad idea. So let's say that you and your wife, she owns a nail shop and you own a wrecker service, and she has 25 employees and you have 35 employees. And she doesn't offer health insurance, but you do. Guess what? You're a commonly owned company at this point. So you have your 25 and she has her 35 and you're a large employer now. Get a divorce. So you as a business owner, you may own a donut shop and that's your main source of income, a donut shop. But you also have on the side a little wrecker service. You don't make a lot of money from it, but you got a wrecker service, right? Commonly owned companies. Say me and my brother and my sister, we all own a donut shop together and we have 15 locations, but each location only has a couple of employees. Guess what? Me and my brother and sister are all now a commonly owned company. So fines are spread. If you choose to pay or play, fines are spread among all the companies. There are a lot of things about these commonly owned controlled companies that we don't know yet. We don't know who's the major employer who offers the health insurance. We don't know if we have 15 different group numbers. We don't know anything yet. Still kind of a work in progress. Yes, ma'am?
What if you're hiring contractors?
1099s? Okay, so here's more IRS regulation on 1099s. Health reform didn't change the definition of a 1099 employee, but let me give you a very simplified explanation of a 1099. You work for me. Now I'm going to hire you to build a fence. And I say, what is your name? Tony. Tony, I want you to build me a fence. I'm going to give you $5,000 to do it. I want it done by March 1st. And you're like, no problem, done. He's a 1099. That's a 1099 relationship. But if I say to you, Tony, I want you to build me a fence. I'm going to give you $5,000. I'm going to let you use all my tools. I'm going to give you a draw every week. And I want you to work from 9 to 5 every day with a 1-hour lunch break. Is he now a 1099 employee? No. Make sure you're meeting the definition of a 1099 employee. So if you're truly doing that, you're going to be okay. But the IRS is going to start looking at 1099s more closely, a lot more closely. These things are on your memory stick and they're actually working links. So if you have any questions about it, make sure you go and review it. Yes, sir?
You said that healthcare has not changed the definition of independent contractor. Has it changed definitions the IRS already uses regarding common control and affiliation?
Has the IRS or has health reform changed the common ownership question? No, it has not. So common ownership, here's some examples, and this is from the IRC. This is code already. It's the common law test. It looks at the percentage of ownership. So if you have someone who has a 0 to 20% kind of interest in the company, it's probably not commonly owned. This is a CPA question. They're going to be able to help you through all of that. This is another place where people are really going to get tripped up. They're going to think that they have, because it's a nail shop and a wrecker service, they're not related. They are very much related with common ownership. So full-time employees, I already mentioned this, 30 hours a week or more. I talked about the paid time off, disability, jury duty, all those kind of good things. Dependents are children under the age of 26. They are not spouses. So if you're a large employer, you have to offer child coverage, but you don't have to offer spouse coverage. Most of you probably will still do that, but you don't have to pay for it either. You don't have to pay for the child or spouse. In your, on your memory stick, this is a really good thing to kind of, if you're questioning, am I large, am I small, what kind of penalties do I have to pay? This will walk you through the penalties, which we haven't even got there yet. I'm going to skip and go directly to this. So if you're a large employer, over 50 full-time equivalents, you have to do two things to avoid the penalty, the excise tax. Number one, you must first offer a plan that is at least a 60% actuarial value. Most of you are probably doing a lot more than that now as a large employer. You're probably offering a plan that's maybe at 80% coinsurance, say $3,000 deductible. It's $3,500 is the average in Texas at about 80% coinsurance. So all 60% actuarial value means is that the user, the client or the person receiving the health care basically pays 40% of their claims. That's kind of what it boils down to. So traditionally speaking, it's a 60% plan. Most of you are not offering 60% plans now. You're offering something much richer. So your health plan might actually help be okay. Maya has an excellent calculator that she can kind of help you plug stuff in, and you can see where your health plan falls. Now it's not set in stone at this point, but it's a pretty darn good calculator. It'll tell you about what your actuarial value is based on your coinsurance, maximum out of pocket, and deductibles. So that's step one. Large employers, a 60% minimum value plan. You're not going to just offer a minimum value plan. So if you're a large employer and you only offer one health plan, those days are going to be long gone. You're probably going to have 4 health plans that you offer because you're going to probably do a 60, 70, 80, 90, something like that, or maybe 2 or 3, somewhere in between there. Because you as the business owner, you don't want a 60% plan, right? You want something very rich. Most employers want that. So the second part to affordable is affordable to your employees. So it's not only 60% actuarial value. Now you have to actually look at how much money your employees make and how much you can charge them. There's some safe harbors we're going to look at now just to see what that looks like. And I know I'm skipping around here, but they're a little bit out of order, my fault. So what affordable health insurance is, or how much money you get to charge your employees, their employee contribution. Most of you probably do either a percentage or a flat amount now, right? So I'm an employer. I pay 75% of employee only, and I pay 0% for my dependents, something like that. But in the future, that's not going to work. That's not going to keep you out of the penalty arena or the excise tax arena. Now what you actually have to do is you have to look at each employee's, and I highly recommend looking at the Box 1 W-2 income for each one of your employees. If you're just looking at a W-2 employee's income, you're not taking into account any deductions that they may have gotten first. So there's 3 safe harbors to make sure that the premium is affordable. Number one, everyone's going to have a different premium. So your higher income earners, so someone who makes $250,000 a year, their premium, their 9.5% is very different than the guy making $10 an hour, because his 9.5% of his premium is not as much as the other guys. The second safe harbor for affordability is just based on a salary, so a monthly salary, for instance, or an hourly wage. And the third safe harbor is based on the federal poverty level. I'm going to give you an example here and show you about all 3 of these tests and why it's going to be very important for you to really look at that W-2, that Box 1 W-2 income. So Box 1 is it's your gross income after any pre-tax deductions that you may have. So Section 125, anything else you've got coming out. That's the true number that you want to use that cannot exceed 9.5%. So if I just use someone's gross income, I would miss the boat. this would be unaffordable for that person. I could potentially receive a fine or an excise tax. So this example, the guy makes $9.50 an hour, and I charge him as the employer $148.75 a month for his health insurance. Number one, the first question is: a guy making $9.50 an hour going to pay $150 a month for health insurance? Only if he's really sick, right? Probably. So we look at his in his pre-tax deductions. It looks like he has $17.85 taken on a pre-tax basis, which really makes his box one $17,975. His 9.5% cannot exceed that $17,975 number. So that's what you get to charge him. You as the employer pay all the rest of employee only. Again, we don't care about any kind of dependents. You don't have to put any money in the pot for them. If you use the second safe harbor, which is really the hourly rate of pay times 130 hours a month because he's full-time, you're going to miss the boat in that one too. Because you're charging $148.75 and his affordability is $117. And if you use the FPL, federal poverty level for a single is $11,170. You're really going to miss the boat that, because in this instance you can only charge $88.43. So you have to take into account those pre-tax deductions. It's going to be very important for you to do that. And if you have payroll, someone doing payroll for you, they know what that box one income is. Questions about commissions are still on the table. What if someone gets a raise throughout the year? What if we have variable salaried employees? What if you bonus? How does all that work? I wish I could give you the answer, but I don't quite know yet. So what happens if you don't meet affordability? So you're a large employer, you're paying or playing. There's a penalty if you offer no coverage whatsoever. It's an excise tax. So if you offer no coverage and you're a large employer, you're going to get fined $2,000 times the total number of full-time employees if one of them receives assistance from the exchange. I know we haven't talked about exchange, but it's coming up. So say you're a large employer, no way, I'm not going to do this. I'm going to pay my excise tax of $2,000 a person that receives a subsidy. Now you do get the first 30 for free, so you get a little break. So secondly, I'm a large employer, I offer a 60% plan, but it's unaffordable. I accidentally charged my employees 10% of the premium instead of 9.5. It was an accident, I didn't mean to, I messed up on the calculations. Well, guess what? You're going to get fined for that as well. So that's why I'm telling you it's very important to kind of track everything as you go. Payroll companies will, and your payroll company probably already does this. They have tracking reports. They probably have so many reports you haven't even looked at them all yet. But these will help you to stay out of the fine or the excise tax world. So what happens if you're a large employer and they say to you, I don't want your health insurance, I'm not doing it? Well, we have a couple of unknowns. We don't know what. First of all, you make him sign a waiver. That is the most important.
Right.
He waives it, he signs it, and puts it in blood saying, I don't want his health insurance, it was too expensive. In today's world, that will count against your participation requirement. But after 2014, we don't know what participation requirements are going to look like. If someone comes to you and says, I have Medicaid, I don't want your insurance because they get it from Medicaid, that's a valid waiver and it does not count against you. But we don't know about things like the exchange quite yet. We're still waiting on some of the other provisions. On participation is going to be a huge one.
So you still can be fined if this guy doesn't want to pay the high, or lady doesn't want to
If
pay.
you, Mr. Employer, did everything right, it's affordable and it's 60%, you're going to do two things. You're going to avoid the fine, and you're going to block every single employee who just came to you and said, I don't want your insurance, I'm waiving out, but you're doing everything right. That employee can't waive out of coverage for you and go get a subsidy from the federal government in the exchange. So you, Mr. Large Employer, do everything right. What you do is you block him from receiving federal funds. And you also get out of paying the fine or excise tax. So if you were a large employer and you said, my company policy is to offer a 60% plan, I'm going to pay 100% of it for each of my employees, you still get to deduct the cost of health insurance for your employees. That deduction didn't go away. You also block him out of waiving out, counting against you, and getting a subsidy from the federal government.
Now, are you obligated as an employer to explain that to the employee? Because you know they're going to say, hey, tell me that.
As of right now, there is no requirement for you to do that. There's no employer notification. There is an employer notification that will talk about the exchange and that it's available to them. So in that model notification that we're going to get from the federal government, we don't know what it's going to say. It's probably going to say more than, hey, an exchange is available in your state. And by the way, even if you do not offer health insurance, you still must provide the exchange notice, no matter what size group you are. If you have no insurance, or if you do have insurance, it will be a federal law. All employers must comply. Just like the little chart you have to put in your kitchen about, the hourly wage, it's going to be the same kind of thing. Question?
For the purpose of the $2,000 penalty, full-time employee, what if they work, like you hired a full-time employee, he only worked for 2 months and then he left? Or like people that work less than a year, how are they going to handle that?
So if he only worked for you for 2 months and you have a 90-day waiting period, he wasn't an eligible employee, he doesn't count against you.
What if he worked for 7 months?
He worked for 7 months, you made him wait 90 days. So you have 4 months, and he waived out of coverage.
Yeah, let's say
If you did everything right as a large employer and he waived out of coverage, you're fine, no tax. But if you charged him 10% or 9.6% of his income, then you're going to get taxed. Any more questions? It's $2,000 per year, and you'll actually get a monthly bill.
Bottom line is you just have to offer a plan that meets the 9.5% requirement for your lowest paid employees. So if you've got minimum wage employees, it's got to be based on that, right? What's the plan?
Right, so you must offer a plan that's at least 60% actuarial value, so the bare bones plan. And if you're a large employer, you don't have to do all the essential health benefits. So it's a 60% plan. And then your 9.5% of each person's W-2 income, box 1 W-2 income. You can have people, all over the place when it comes to premiums. Or you could do what you said. My lowest paid employee makes $10 an hour. I'm only going to charge everybody 9.5% of $10 an hour.
You can offer different premium rates for different salaries.
Yes.
So it can be different for every employee.
I want to make sure you guys hear this. You can offer different premium contributions for each employee. So if your guy making $10 an hour, he's going to pay a different premium than the guy making $200,000 an hour. Let me just throw another little wrinkle in the thing. I think I found another loophole. So the guy who's making $100,000 a year, his 9.5% of his premium is $9,500 a year, right? So he's going to put $9,500 a year of his hard-earned money into your pot. What if his premium isn't $9,500 per year? His total premium? What if it comes out to be $9,200 a year? The federal guidelines are tied to the W-2 income, not the premium being charged. You get it? So what if your highest income earners were putting their money in the pot, right? And the lowest people were putting their money in the pot, and you're, Mr. Employer, you're collecting all the money, and then it turns out, oh my God, I got 20 bucks left over. What do I do? Right? This is not addressed in any of the federal guidelines yet. And don't talk about it because I don't want the feds to catch on. That could, I don't think that would happen because I think premiums are going to be a little bit more expensive than that, but because of the wording of the law, it's all tied to being affordable to the W-2 income. It's all tied to the person's income, not premium. You have a question? So in that case, you'd want to use a different safe harbor. You would want to make sure that at any time that you are charging them premiums and you're a large employer, that you're not missing the 9.5%. So in theory, when you're in high season, when they're always working overtime, right? And so he's making a ton of money 6 months out of the year. His premium is tied to that 9.5% of that high income potential. But then you have a lot of rainy days during the last part. His affordability factor is going to change throughout the year. That's why I'm saying payroll companies are really going to help you work through this process. So you could potentially change his premium contribution during the year. As rules are written today, that could change. But as today it's written, you could charge him something different in February than you did in September.
Discrimination?
Yeah, discrimination is one of those things that the IRS is currently working on. So if any of you have discriminatory plans now, get ready, because you're probably not going to have that for much longer. When I say discriminatory, I mean your directors and managers, you charge them $50 a month, but your hourly employees, you may charge them $150 a month, anything like that. Or you have a carve-out where you only insure a certain class of people. All that's coming to an end. So we're waiting for the IRS to clarify discrimination rules, and they've been saying for the last 3 months they're coming out any day. I promise there will be some kind of safe harbor for people who are discriminating in plans currently. So if you're classing out employees, I'm sure there'll be some kind of safe harbor, but I have no idea how long that is.
So you're saying if I have a group of psychiatrists and they're really hard to hire and I want to pay all of their benefits and I have an employment agreement with them to do that, I won't be able to do that in the future?
Yes, you will still be able to do that. But you must also put the receptionist who's making all the appointments, you have to do the same thing for the receptionist. So whatever you do for one class, you're going to be required to do for all classes of employees. So there's no more highly comped benefits where you pay a different percentage of their medical premiums versus an hourly employee. That's not going to be allowed. The rules aren't out yet, but like I said, we anticipate them any day. Well, we don't know exactly how that's going to work yet. So if it's a variable hour employee and one month they made 200, the next month they made 2,000, how do you do the 9.5%? The rules say now, if you're a large employer, it must be affordable to each employee, not exceeding 9.5% of their income. So it leads us to believe that 1 month you're only going to charge them 9.5% of the 200, and then the next month you're going to charge them 1.5% of the 2,000. So we don't have 100% clarification on that. That could happen. And the trigger is that one of those employees goes to the exchange and receives a subsidy. That's how you get caught.
And they have to show that they receive a subsidy during 2014?
I don't know. I have, because you can't retroactively get an exchange plan in 2013 if you're in 2014. So that probably wouldn't happen. There are just some things I can't give you the definitive answer to, and that's one of them. Yes, ma'am. And if you have no payroll deductions, that's a great thing to do. But if you have deductions, you're not going to meet the 9.5% or affordability test. So if you just say, I pay you $20,000 a year, I'm taking your 9.5% off the $20,000 a year, but you have any payroll deductions, then that plan is unaffordable to that employee. And how you're caught is very simple. One of your employees goes into the federal exchange, which will be state-based we will have a federal-based exchange in our state. They receive a subsidy from the federal government. They're going to say, who do you work for? And they're going to say ABC Pest, and they're going to say, well, how much did they charge you? Well, they charged me 15% of the premium, and they're going to say, ooh, that's unaffordable. They're going to come back and look at you. Let's talk about exchanges pretty briefly. So everyone started out calling these things exchanges, and now the federal government's calling it a marketplace. So this is one of the things they're doing through rulemaking, is they're kind of changing terminology as they go. So the marketplace/exchange is basically a TurboTax. So what's going to happen is if you're a small employer, or if you're an individual, or even if you're a large employer, your employees, and possibly even you, are going to go to the marketplace. It's going to look like TurboTax, kind of. What's your social? How much money do you make? Where do you live? What's your zip code? Who do you want to cover? Who are your dependents? And what's their social security numbers? They're going to ask you a set of questions. Kind of develop some risk tolerance to determine if you want a $2,000 deductible or a $500 deductible. What kind of co-insurance? 60%, 70%, all the way up to 90%. So it's going to kind of ask you some questions. It's going to ask you maybe questions about dental, pediatric, vision. So you're going to get through here, and supposedly instantly it's going to talk to the IRS, Homeland Security, and a host of other federal agencies, and it's going to say, okay, Misty Baker, you make $30,000 a year, you have 2 kids, so you're a family of 3, you fall below the federal guidelines, the federal poverty guidelines, you're going to receive Medicaid. It's going to tell you instantly once you're on the Marketplace website, or instantly when you're talking to someone on the phone, or when you're in front of them at the Marketplace office. So I'll instantly receive a subsidy. That means I pick out Blue Cross Blue Shield Bronze Plan number 1. The government says you don't have to pay anything for it, and I get my insurance ID card. Say if I make $60,000 a year, family of 3, and the Marketplace is going to say, okay, you don't qualify for Medicaid, you make too much money to do that, but you do qualify for a subsidy. Your subsidy is $200 per month. Which health plan do you want to pick? And so I go through and I say, okay, I want a United Healthcare Silver Plan. And that's going to pop up on the screen saying, okay, that premium is $1,000 a month for you and your 2 children. And I'm instantly going to receive the $200 subsidy right there. So I have to write a check for $800. That's how an exchange/marketplace will work. It really is going to be, supposedly, that seamless and easy. You and your employees are supposedly going to be ready to rock and roll with these exchanges by October 1st. So that means you as an employer, you need to have a plan before then. So if you're a large employer and you're going to say, forget it, I'm going to pay the excise tax, here's where you might want to go to purchase health insurance, you might qualify for an exchange subsidy, here's how you do it. Or you're a small employer and you say, I don't want to play in the health insurance world anymore, I'm done. I'm going to go get an individual plan, I don't qualify for a subsidy in the exchange or Marketplace, but you guys might. Here's where you go. And remember that everyone is guaranteed issue, so everyone can get health insurance. It just depends on where you're going to go to get it. Yes, ma'am?
What if your company is
The policy is grandfathered. Not everything applies to you, so we can talk after the meeting about what you need to do and what you don't need to do. Basically, don't get ungrandfathered if you're grandfathered. Stay grandfathered. For right now, being grandfathered is actually a pretty good deal. After 2014, I'm not sure that it will be, because I'm not sure how the rates are going to look. I'm on a grandfathered plan as well, so it just depends on what the rates look like, the preventive care. There's a whole host of things you have to study. One of the things I don't know if you've picked up on yet is that you're going to have a lot of choices moving through into 2014. We haven't even talked about HRAs yet. We haven't talked about HSAs, none of that. We're not going to get to it today. There's a lot of things you're going to have to know. So if you're just getting a spreadsheet once a year, put it in front of you and say, okay, pick one of these plans, they're so pretty, that's not going to work. You are going to have to know a little bit more, because is it a better option for you to have an HRA, to buy down a $10,000 deductible to $2,000 deductible? How much is that going to cost you? What if you're a large employer and you want to offer a 60% actuarial plan? Do you also want to offer a 90%? Can you use an HRA in that instance as well? There are so many more options that you're going to have to know. What does it look like? What does it look like to pay an excise tax versus pay premiums? What does it look like to have all of your employees, you erase the group health plan that you've been paying on and providing to your employees for the last 5 years? They see that as a huge benefit. And then you're going to take it away in 2014. Are they going to work for you, or are they going to go look for somewhere else that has health insurance? It's not just about writing a health insurance check. It's a huge story. So you want to partner up with someone who actually is very qualified to help you do that. If you're a small employer with under 100 lives, you can do something called the shop exchange. It's only for small employers, and it puts you as an employer inside of the exchange model. The only reason I think you would want to go inside of an exchange, whether you're an individual or a small employer, is to receive a subsidy, or if you're a small employer, the tax credit. If you're not receiving the tax credit today and you're a small employer, you're not going to receive it in the shop because the numbers didn't change. I would never purchase from an exchange, i.e. the government, my health insurance, unless I was receiving a subsidy. unless I was getting money from them to do it. It's going to be like calling the IRS and saying, hey, I need an ID card. Can you send me an ID card? Or I have a question, why was my EOB, why does it say I had to pay 40%? I thought I had already met my max amount of pocket, but it's the IRS that you're going to talk to do that. I would much rather stay in the outside insurance market to get my health insurance and go to the IRS to do it. You're going to see some talk about private exchanges. We're kind of running out of time, so I'm going to skip that. This is to give you a calculator. This is on your memory stick. This is really important. So I want you to go back and look at your payroll. How much are you paying people? If you're a small employer, you're going to say, okay, well, I pay my people, $15,000 a year. They're going to qualify for Medicaid right off the bat. They'll pay $0 for health insurance. If they go through an exchange, they'll get into Medicaid. But look up here. If a single person that you employ makes over $44,600 a year, they still receive a subsidy in the exchange. Now, it's a smaller subsidy. They'll pay about $350 a month for their health insurance. This will actually give you about what the subsidy will look like, and you can plug that number in for all of your employees and just kind of see. If you highly comp most of your employees and they're going to be outside of this Medicaid or health insurance exchange model, I'd keep them out of it if I could. So when I say subsidy, you know that's your tax money, right? That's tax dollars that we're all going to put into a pot and pay for people who, so a family of 4 making $92,000 a year will still receive a subsidy from the federal government for their health insurance. Those are poor people. If you're a family of 8 and you make $155,000 a year, you're poor. You will receive a subsidy if you go to the exchange. There's more information about the SHOP and tax credits on your memory stick. So number 1, do you have a qualified broker to help you move through all of these changes? Because there are a lot of them, and there are more every day. I joke to Jean and Maya that every week I get about at least 150, if not 500 pages of regulation. Currently, there have been issued over 13,000 pages of regulations by either the IRS or Department of Labor or Health and Human Services. They expect over 1 million pages of regulation to define and clarify all the questions you guys have been asking me today. That's a lot of pages. So do you have to pay or play? Are you a large employer? Did you do the calculation to get your full-time equivalents or maybe your percentage of bodies? If you decide not to offer health insurance and you're a large employer, what does that excise tax really look like to your bottom line? If you're a small employer and you don't offer health insurance today, are you going to offer it in 2014? If you're a small employer and you do offer insurance today and you take it away from them, are they going to work for you? Are you going to reduce number of work hours for your part-timers to stay under that 50 full-time equivalent? Are you going to fire people? Are you going to stop hiring people? Are you going to hire seasonal employees? Are you going to use a temporary agency? I mean, there's a lot of things to consider. You need to establish your measurement period, and I beg you to start it in January. So if you're a large employer, start it now. Measure it in a full 12 months. You don't have to declare anything just yet. But at least measure it for 12 months and to see when your high and low seasons are. You don't want to renew your health plan and bring 60 people on your health plan if you have a 12-month look-back period. And if you only had a 3-month look-back period, you only had to bring on 6. So make sure you're measuring your employees' hours. And then I want you to budget for a potential rate increase in 2014. Some people, number 1, some people think that this is really going to decrease the cost of health insurance. It might after year 3, but the first 3 years we're going to do a lot of kind of wiggling around. So Milliman did a study that says employers will pay between 30 and 50% more for a health plan in 2014. What they didn't say is that in 2013 when you renew, expect about a 30% rate increase in Texas right now. That's an average. So some of you will see a lot less, some of you will see more. So what are companies asking me? Because remember, I get to travel all over Texas talking to employers like this, and you all look angry most of the time. Luckily, no one's thrown anything at me. I asked Bob if I needed like a chicken cage up here sometimes with the beer bottles coming at me. All right, so are you going to drop coverage completely? Are you going to pay the excise tax? Are you going to keep existing coverage for your current populations but not offer health insurance and pay the tax or excise tax on those people? Are you going to reduce work hours for your workforce? It doesn't work for every model, but I've seen some employers get pretty creative. I've seen restaurant chains, fast food restaurant chains, put in their employee handbooks, nobody works over 30 hours a week anymore. And he may have 800 part-time employees and 20 full-time employees. He does have to pay or play, but he's only got to do it for the 20 people, right? Because part-timers don't count. Think about that as a strategy. So Forbes did an article in November that just said, if you're going to drop your coverage, you're probably going to lose a handful of employees too. And I always use the example of highly skilled workers like welders. There aren't welders on every corner, okay? Welders are a highly specific, trained occupation. If you own a welding company, it might be difficult for you to make them all part-timers. Your business model may not work that way. So you have to be pretty flexible. How much will it cost you? You have to decide if you're going to pay or play. And then again on your memory stick, I didn't make this up. I would have made it a much nicer story for you, I promise. So anything that we talked about today I've sourced, and it's all on your memory stick, so you can go back and look. The IRS one about full-time employees at 12-58 is a pretty good one. And as we get more updates, we're going to make sure that it's all updated for you and you can see more stuff. If you have any questions, you can also, Dean and Draper has an email address set up, healthcarereform@deandraper.com. So if you have any questions, you can email them and they will answer them for you. I'm going to stick around a little while to answer any more questions. Does anyone have any questions for the group? All right, thank you for coming.